valves are one-way valves. These are there inside the heart. There are 4 valves and they regulate the direction of the flow of the heart. Aortic valve is situated between the left ventricle and the aorta. The aorta is the largest artery of the heart. When the left ventricle pumps, the blood goes through the aortic valve into the aorta and the blood is supplied to the rest of the body. Now, aortic valve can get diseased sometimes. Over a period of time, the aortic valve can get narrow. Because of the aging process in some patients, some elderly patients, the aortic valve degenerates, and because of that, the aortic valve becomes narrow. So this narrowing of aortic valve, this condition is called as aortic stenosis. Sometimes patients can experience chest pain, especially when they walk or walk fast or climb some kind of a physical or psychological exertion. When the heart beats harder, then they can have chest pain, what we call as angina. Commonly, patients have breathing difficulty. When they walk, they get breathless, and they sit down, they become relieved from the breathlessness. Extreme narrowing of the aortic valve reduces the blood flow to the brain, and people can have giddiness, or sometimes they can even fall down unconscious. There are a good number of patients with significant aortic stenosis who can be asymptomatic. They have no symptoms, but they are routinely, when they go for a routine heart check, then the doctor can find out that there is a problem in the heart, and then they are accidentally detected. Unfortunately, aortic stenosis cannot be treated with medicines alone, and once a stage where severe aortic stenosis is reached, from little narrowing, the narrowing of the aortic valve becomes quite serious, patients will have symptoms, and once they have symptoms, there is a risk to their life. So therefore, aortic stenosis has to be treated in most instances, and replacing the aortic valve is the only known treatment for severe aortic stenosis. Now, replacement can be done in 2 ways. One of them is the traditionally done, what is called a surgical aortic valve replacement, or these days we call it as SAVR, and then where it's an open heart surgery, the chest is opened up and the heart is cut open, the valve which is diseased is removed, and an artificial valve is implanted and stitched into it. The other form of treatment, which is non-surgical, whereby valve which is compressed is taken up into the heart and it is released at the place where the diseased aortic valve, that is called as transcatheter aortic valve replacement or transcatheter aortic valve implantation. So these are commonly abbreviated as TAVR or TAVI. Now this is unique when compared to a surgical aortic valve, not only because it avoids surgery on the chest and the heart, but also there are no stitches. The valve sits in the position by a mechanism of pressure, like how stents sit inside the coronary arteries. So similarly the valve sits. So TAVR is a reasonably simple procedure, at least to explain, that is through an artery in the groin, the valve is taken up to the desired position and it is released there and it sticks there, and as soon as the valve is released, it starts functioning like a normal heart valve and the circulation is established. It's typically a short procedure. Patients who are older, who have multiple other system diseases, what we call as comorbidities, because of which the risk of aortic valve open heart surgery is high, in such patients who are unfit or who are very high risk for open surgical replacement, those are the best candidates for TAVR procedure. So typically we admit a patient a day before the TAVR procedure. The entire procedure should take somewhere between 1 to 1.5 hours. So in general we can say the patient can recover well within a week's time if there are no complications.